Hello there. This is Dr. Greg from Celebrity Dental Clinic Owerri. Today's discussion is actually a unique one because when I went somewhere to buy something and I met the seller with this kind of condition, I will show you briefly. And so I discussed with him and he told me something that's very, very funny. All right. But look at this first. Look at it. This is a single tooth discoloration. I'm sure most of you have seen some persons with this kind of tooth. Some of you may even have it and you don't know what to do or what actually led to this. I'm going to tell you about it, what led to it, and what can actually be done to make it okay if you want it to be fixed. So first of all, if you meet a person like this, or you meet someone that has something like this, one thing is very, very common with it. Is either that the person had an accident in the past, or fall, or maybe he or she was in contact sports, maybe playing football or something like that. Somebody hit him or her on the face, and at the end of the whole thing, after a while, you started having this discoloration. So what really happened when you have something like this is because your tooth has dual blood supply. The dual blood supply means that there is blood vessel that enter into the tooth through the base, I mean the roots of the tooth, through the base and enter inside it. That is the one that give nutrients to the inner part of the tooth. That's what makes it alive inside the pulp there. Okay, that is one. Then the second supply is the one that supply the periodontal ligament, which is the one that makes the tooth stay inside the bone. When something like this happens and eventually cut off the blood supply from the base of the tooth, over a period of time, that small part of blood vessels inside the tooth will start degenerating. And the moment they are degenerating, remember, the blood cells has iron in them, and iron is very, very known for its color. And so as they are degenerating, they are causing this thing that is visible to you outside. It's not something that just pump up like that. It gradually causes this discoloration over a period of time. Otherwise, some person will tell you, there was a time my tooth was very white. This particular one was very white, just like other ones. But after the accident, after a while, I started having this discoloration. And that's what happened. The person may not actually have pain because of this. But remember, when there is necrotic tissue inside the body, your body will try to force it out. Anyhow, it's a natural thing. And in the process of doing that, you will look for the softest part of the body to force this thing out. And that is why, over a period of time, the person may start having swelling at the base of the tooth, whereby the body is trying to force those things out. And that may cause boil at the base of it. From time to time, it will burst and it will still come up again, just on and off, on and off, another. But some persons over a period of time will not even have this sign or symptom, but they'll still be walking around with this discoloration. And some will tell you, where is my identity? I don't want to do anything about it. Is my signature? Everybody knows me with it. In fact, my girlfriend even told me that men actually, my girlfriend even told me that I love you because of this your tooth. Please, that tooth is dead in your mouth, and there's nothing stylish or very sweet or cool with having a discolored tooth walking around. So even if your girlfriend told you about that, please, there's something to do about it. It's a diseased tooth, so you need to take care of it before it causes serious problem for you. All right. So what did you do for this person? There are two ways to this. And so this particular case, I saw the person and I walked up to him and told you this your tooth can actually be fixed and this is what it's going to take another. And surprisingly say, I don't want to remove the tooth because the first place I went to before when I noticed this discoloration, the dentist told me that we will remove the tooth and after that we'll give you a removable partial denture. And I laughed and I told him no, that it has gone beyond that. Possibly what they told you then is a long time. I said no, that's not a long time. I said anyway, you don't need to argue with that. If you want it fixed, yes, you can actually be fixed. And I now showed him from my phone the one we did, and he got interested. And eventually he came, and that's what happened. So what did we do? We just did the root canal, and we did internal bleaching, and everything was fine. And so it's all smiling. So you see, there is a change, and you never knew all this why there's something like this will happen. So the same way, you that is watching now, if you have this kind of condition, or you know anyone that has this kind of condition, I'm telling you now that it is feasible. So just visit your dentist. You will definitely know what to do with respect to that. If there is other alternative, after the root canal, they could actually do a crown for you. That is another alternative to internal bleaching. So they'll put a crown on that tooth, and that tooth will still be fine and looks like the other ones in question. So please, there is nothing stylish about walking around with a tooth that is discolored in your mouth because it's already diseased. You need to take care of it. If you are hearing this for the first time, or you know anyone that may need this particular discussion, please forward this to the person or let the person know that there is solution to his or her problem. All right. When next you see someone with this, tell the person that it can be fixed. Thank you, and God bless you. Have a lovely day.